Okay, well, good news continues. We've been watching this national heat map about transmission rates throughout the country, and over the preceding 4 to 6 weeks, it was somewhere between 92 and 94% of the counties were in the high transmission rate category, and now we're seeing it down to 84%. Over the past week, nationwide cases have dropped 12.5%. Looking at cases by vaccination status, this is from the CDC. It does show that the majority of our cases, this is the case rate per 100,000 right here, the majority of our cases are in the unvaccinated population. So it does show that the vaccines do prevent people from getting COVID, although it's not 100%. And so there's a 6% increased risk of getting COVID if you're unvaccinated, and an 11% increased risk of death from COVID, just highlighting the importance of vaccinations. Washington State Department of Health, we've published this data before, and these numbers really haven't changed, but our statewide data show that unvaccinated individuals are 4 to 6 times more likely to get COVID if they're unvaccinated. And if you're between 12 and 64, you're about 19 times more likely to get hospitalized. The reason why I put the national data is we don't have high enough numbers in these younger age groups for deaths to calculate adequate numbers, but according to Washington State data, you're 9 times more likely to die of COVID if you're unvaccinated. So again, just highlighting the importance of vaccination. Looking at our case rate curve for Washington State, it continues to go down. We've seen that for the past couple of weeks, happily. And then looking at the Walla Walla case curve, we're seeing cases are going down. Our internal numbers as of yesterday put our case rate at 500 for a 14-day case rate curve. And so our case rates are somewhere around here, about what we saw in the upswing from July. And so if you look at the peak, which was between September 1 and September 14, and then looking at our case rate now, our cases have dropped about 44% over the past month. There have been a lot of questions about the effect of the county fair, and it took a while to do some case investigating, but we were able to identify 7 cases linked to the fair. 4 of those were in Walla Walla County residents and 3 in Umatilla County residents. I'm going to go back to our Walla Walla case rate curve. So this peak right here is about September 1. And with school reopening and the fair, there's a tiny little blip right here, but in general, we did not see any significant increase in our case rate in those 2 events. Vaccines in Walla Walla. 2 weeks ago, we reported about 1,000 shots during that week. Last week, about 800, and now we're down to about 480. Our primary vaccine doses have been cut in about half. So the most of our business is booster shots, and we anticipate that will continue to keep going on. Although we did over 800 2 weeks ago, and now the rate's about half that. Overall, based on CDC tracking data, our eligible population, which is 12 and over, we have about a 64% vaccination rate. We've seen that this number has been increasing about 1 to 2% per week. Things might be slowing down a little bit at this time. I just want to also remind our community to look out for signs and symptoms of COVID, and the signs and symptoms can be pretty subtle. And we're asking people to get tested, not so we can be intrusive, but I'll kind of explain the process. We're here to help you and offer you support. So the Southgate Community Testing Center has been doing around 50 to 100 tests per day. And that's free of charge for the community. It has a quick turnaround time. It's very convenient. You can also get tested at other areas throughout the community. But if you get tested, you will get, the Department of Community Health gets these test results, and our case contact team will notify the state CREST team, and I'll explain that in a second. But what we can do for you is we just do a quick 5-minute call and we do counseling regarding warning signs and symptoms, things for you to look out for, things that if you get these signs or symptoms, to contact your healthcare provider. We also counsel people about the isolation period, to let them know when their isolation period has ended, but also to make sure they have the means available to do the isolation period. And we can connect them to local resources to get food, medications, financial assistance, things like that. And we can also refer to Care Connect and Health Space, and I'll explain that in a minute. So this initial call is a local call. It's very short, only about 5 minutes. As I mentioned, once we get the cases, we send these to the CREST team, which is for this case risk and exposure tool. This is the contact tracing and contact investigation process, and we were performing this on our own, but several months ago, due to staffing issues, we turned it over to the state, and we felt this would be helpful to let them do a lot of the legwork and administrative work, and then we can turn our attention towards more of a personalized follow up with our county constituents. So this process is a little bit lengthier. It's about a 15 to 20 minute process. So that's usually a West Side area code. Care Connect is something that we can offer when we do that local 5-minute call, and it's a program that Department of Health has set up, and in our region, an arm of Providence St. Mary Population Health administers this process, and it's just another avenue to get assistance with food, certain supplies you may need at home, financial assistance such as rental assistance and mortgage assistance, things like that, things that you may need so you can stay at home during that isolation period. They can also help with certain medical delivery services. I potentially get a pulse oximeter, make sure there's good communication with your healthcare provider and things like that. But it also connects you with all of our local agencies to make sure you're getting all the services that you need. Also, our team will offer to have you sign up for Health Space, and it's basically a daily email or text that's a survey to check on your symptoms. We review these responses daily, even on the weekends. So if we notice that symptoms are becoming bothersome, we can call and do some counseling and offer assistance getting some medical attention. But also during that process, you have the opportunity to ask questions, and we have staff that can help you with that. So this process is set up to keep people from preventing them from getting to the point where they're really, really sick. We want to keep people out of the hospital. We want to prevent severe illness, hospitalization, and death. So keeping in contact with us and your healthcare providers, hopefully we can initiate some treatment before it gets too far down the road. And just a reminder that these are some of the symptoms that you may be, if you get COVID and have these symptoms, you'll definitely want to seek care. But we're hoping to people will participate in this process so we can maybe mitigate risk and prevent them from getting to this stage in the game. That's the end of my report, and just want to let our community know that we're here to help all of you, vaccinated and unvaccinated, and likewise encourage people to get vaccinated and stay safe.